This is going to be a brief video to explain the pros and cons of radiotherapy treatment for Dupuytren's disease. Now, I've covered Dupuytren's and all of the usual treatment options in detail in another video which I'll link to up here and in the description below, so do check that out if you want to know the details of this really interesting condition. Now, I'm mainly doing this video because of all the comments I've had from people either asking about radiotherapy treatment or sharing their own experiences of it. Now, I didn't include radiotherapy in that other video, mainly because the whole point of this channel is to focus on evidence-based treatments only, and at the moment radiotherapy is considered an unproven treatment for Dupuytren's disease. So in this video I'm going to unpick the details of radiotherapy, what we know, what we don't know, and the type of person who it might be helpful for. So I'm Stephen Bunting, I'm a specialist MSK physiotherapist working in the UK. Welcome to my channel. So first up, a very quick recap of Dupuytren's disease. So this is an inherited condition which causes a thickening of the palmar fascia in the hand. It's thought, although a recent study has refuted this, that it came from a genetic mutation in the Vikings because it's much more common in Nordic and Northern European countries, hence its alternative name of Viking hand. Its symptoms are the development of nodules in the palm like this, a pinching like this, or most commonly a band or a cord like this in the palm or the base of the fingers. It's rarely painful except sometimes when it first develops, but any pain nearly always settles down over a few months. Now, when someone first develops a band or a nodule in the palm, then in the vast majority of cases it will stay for life. Dupuytren's is unfortunately an incurable condition. There have been reports of small nodules going away by themselves, but these really are the tiny minority of cases. For the vast majority of people, it's a lifelong condition. Now, it can stay as just a small band or a nodule that never progresses, but sometimes it can thicken and spread to wider areas of the palm or fingers. And sometimes the bands can tighten and cause the fingers to bend. It can affect any finger, but it's far more common in the little and ring fingers, which can end up looking like this. Now, Dupuytren's is unusual for an inherited condition because symptoms tend to develop later in life, most commonly over the age of 50. And the general rule is that the later in life the symptoms appear, the less aggressive it tends to be. So, if you get some lumps in your palm in, say, your 80s, then it's highly unlikely to progress beyond a few small nodules. But if it starts in your 30s, then it's much more likely to progress and cause bent fingers. The standard treatment for Dupuytren's disease is to leave it alone until the fingers become bent enough to cause a problem. And it may never do that, but if it does, then treatment is usually advised when a finger or fingers reach about this degree of bend. At that point, the treatment options are either a needle fasciotomy, a collagenase injection, although this treatment is currently unavailable in Europe, Asia and Australia, or surgery in the form of fasciectomy or dermofasciectomy. Now, I'm not going to discuss the details of these treatments here because I've already covered them in detail in my other video. Radiotherapy uses a type of ionizing radiation to essentially kill diseased cells in the body. It's most commonly used in cancer, where it aims to target tumour cells and kill them. In Dupuytren's disease, low-energy X-rays are directed at the affected cells in the hand, and the idea behind the treatment is to try and shrink the thickened Dupuytren's tissue before it can cause the fingers to bend. So, basically, it's a preventative treatment. It aims to shrink the nodules or bands and stop them from progressing. If your fingers are already bent beyond about 10 degrees, then radiotherapy won't be helpful. you're going to need one of the other treatments that I mentioned earlier. So radiotherapy can only be used when the fingers are straight or almost straight. Well, the pros of radiotherapy are that it can shrink the Dupuytren's tissue in the palm and then potentially slow down disease progression in the hand over time. The cons are that it uses radiation, which can be harmful and carries a risk of damaging healthy cells. Now, some of the side effects of radiotherapy are local skin changes in the palm, such as redness, itching, skin dryness or flaking, although these would usually be expected to improve over time. Now, there's also a risk of longer-term damage, such as thinning of the skin, scar tissue, or a loss of sensation due to nerve damage. And rarely it can cause chronic pain or finger stiffness. There's also a theoretical risk of it causing cancerous cells in the hand, which could then spread to other areas of the body. So it's not a risk-free procedure, and you'd need to weigh up these risks against the potential benefits in your individual case. Now, bear in mind that the main reason to treat someone's hand with radiotherapy is to prevent the condition from progressing. But, as I mentioned earlier, we don't know whether it will progress in someone or not, so you might potentially have this treatment and it might never have progressed anyway. So, you might have exposed yourself to unnecessary radiation and you'd never know. And so the decision as to whether it's worth treating someone's hand often comes down to whether the disease is expected to progress and lead to bent fingers in your individual case. And the risk of that happening is most strongly related to the age of onset and your family history. So if you develop nodules in, say, your early 40s and both of your parents had Dupuytren's, which went on to cause bent fingers, then you are at a higher risk and you might be more interested in considering radiotherapy compared to someone whose symptoms developed first in their late 70s. So it's a very individual decision. The other scenario where radiotherapy has been used is in persistent pain, but this is a rare symptom of Dupuytren's. Like I said earlier, pain is often short-lived and it can be helped by other treatments such as topical gels or cortisone injections. So if you are considering radiotherapy for the pain associated with your nodules, then it would usually be best to wait a while and reconsider your options if the pain is still present after a year or so. Unfortunately, there are only a handful of studies that have looked at radiotherapy for Dupuytren's, and the overall evidence is inconclusive. In the UK, the National Institute for Clinical Excellence, known as NICE, looked at the research in 2016 and concluded that there were no major safety concerns, but the effectiveness of radiotherapy was uncertain, as the evidence was of poor quality. The studies they did look at showed varying results. One reported that 3 years after treatment, symptoms had improved in about 50% of treated hands. 35% were unchanged and 15% were worse. Another study, again at 3 years after treatment, reported that just 10% of hands improved, 59% were unchanged and 31% were worse, with 20% of those ending up having the surgery. So as you can see, the reported results are very variable. Long-term side effects were reported in 39% of people and included mild skin tightness, dryness, peeling, skin thickening or thinning, skin darkening, grip weakness, reduced nail health, mild swelling and altered sensation. 4% of people reported a loss of palm sweating, which was still present 40 months after treatment. So overall, it's difficult to draw firm conclusions about this treatment, and because of this uncertainty, radiotherapy is not offered in all countries or funded by all healthcare systems. More quality research is clearly needed, and as of 2024, that's still not happened. The best advice I can give is that if you are a younger person, say under 50, with nodules or bands, but your fingers are still fairly straight, then you might want to get a specialist opinion. Well, I hope this video has been helpful in answering a few questions about radiotherapy for Dupuytren's disease. Until the next time, take care and bye for now.